It's a pleasure to be here, especially on this first inaugural Docs of Color, DNPs of Color conference. My name is Kellie Bryant. I am currently Assistant Dean of Simulation and Clinical Affairs at Columbia University School of Nursing. Have the pleasure of working with Stephen. And I'm also Associate Professor. So some of my everyday work at Columbia is a lot to do with providing an educational program for all of our students. But I also am working very hard to make sure we have DEI in our curriculum and giving back to our community through community service. So pleasure to be here.
Thank you so much, Dr. Bryant. Next up is Dr. Vivienne Pierce-McDaniel. Can you introduce yourself?
Well, hello, and it's Vivienne Pierce-McDaniel. Thank you so much. I am super excited to be here for this first DNPs of Color conference. I am a professor at Aspen University, and I am also a DEI consultant for 2 universities, James Madison University, go Dukes, and as also for for American Sentinel University's Sentinel U, which is a simulation product. I am excited to be here.
Thank you, Dr. Pierce-McDaniel. And last but not least, Dr. Danielle McCamey.
Good afternoon, everyone. My name is Dr. Danielle McCamey. I am the founder, CEO, and president of DNPs of Color. It's an honor to serve on this panel with these esteemed guests, and I'm looking forward to an engaging discussion, and welcome everyone to our conference. Thank you so much.
All right. So now everybody's introduced, and I do have some questions that, again, let's try and make this a interactive discussion, and we're going to talk about promoting diversity first. So let's see. I am going to ask Dr. Buscemi to kick this one off. What does promoting diversity mean to you, and does this impact change? Dr. Buscemi is muted.
Thank you. I had a little pop-up says you are not allowed to unmute yourself.
Okay.
Yeah, just stay unmuted. Just stay unmuted.
Oh, stay unmuted. Okay, stay unmuted. Okay, got it. I'm sorry, Stephen, repeat the question again.
Yes.
I was figuring out the mute button.
Absolutely, no problem. What does promoting diversity mean to you, and does this impact change?
So I come from the lens of a gay Latino man, but I also understand my role as an ally to people of color. So I understand the importance of allyship. I understand the lived experience that I have as a gay Cuban American, and how I can use my privilege as a white man to uplift those that need to be uplifted. So I have 2 roles. I have a faculty and administrative role, and I also am a clinician. And I've been with the same wound care practice as a wound care nurse practitioner for 16 years. And because of my passion and drive for DEI, I've been able to become involved in many aspects. I mean, I'm proud to say I sit on the DEI committee for the AANP with Danielle. That's how we met. And she invited me to participate in this wonderful opportunity. I'm in the midst of launching our DEI committee at our College of Nursing at FIU. And because of my work, my practice heard about it. And actually Wednesday, I will be there to provide the DEI initiatives for our practice. So, and I need to remember that I need to frame this as equity and diversity for those who have been historically marginalized and misrepresented, and not just see things from the lens of who I am, but what everybody, we all need to get to. And that's how I think. And I think once that's established, especially in the academic arena, then we need to take it and start infusing it into curriculum. And I agree. I mean, I was so inspired by Dr. Beard's presentation, and there are so many things that are lacking in our textbooks, in our curriculum, that not only misrepresent people of color, but misrepresent gay men, LGBTQs, trans women, trans men. It's just unbelievable the things that you read and that it's still being published today. So I think that's where is this whole idea of disrupting and dismantling the norm and making diversity, equity, and inclusion the norm.
Thank you, Dr. Buscemi. Dr. Bryant, same question. What does promoting diversity mean to you? And does this impact change?
What does promoting diversity mean to me? It means that, I think about it multiple different ways. If we're a nurse or working in a healthcare setting, patients want to see people that look like us taking care of us. We have a vested interest in those patients. We understand their culture, some of their values. And we know the research shows that, there was the most shocking one that I found was that newborns that have Black pediatricians, Black newborns, actually have a 50% higher rate of living. Their mortality rate is actually decreased because they have a doctor of color taking care of that patient. So imagine all those other areas where it's impacted. And when it comes to education, because I'm a professor, students want to see people teaching them that look like them. I have a particular lens I'm looking at the curriculum through. I want to make sure that we're addressing all those DEI issues when we're teaching our fellow future healthcare professions, because I have a vested interest in making sure that people that graduate are going to be able to be advocates for our patients. They're going to be advocates for health equity, that are going to go out there and make a change that we so desperately need in our healthcare system. So that's why it's important.
Thank you, Dr. Bryant. Dr. McDaniel, same question. What does promoting diversity mean to you? And does this impact change?
Oh, it absolutely does. I view diversity just as the name implies, a variety. There are a variety of meanings, and what I look at is diversity of thought. What do these diverse people bring to the table? What are the different thoughts and ideas that these people bring to the table? It enhances creativity. It brings innovation. So that's what I'm looking at. And that's why I promote diversity, because one thing that I don't like when people, I don't like monotony. Let's just say that. So I rarely take the same route home, because it has to be diverse. Everything has to be diverse. So I think that when people are diverse, that the problem solving is different. Decision making is different. And people are just more innovative. They bring more things to the table. And it impacts change because just what I just said, you have all of this multitude of ideas that people are bringing forth because they have their own lived experiences. So definitely I promote diversity at every angle, every corner, everywhere. So that's how I view diversity.
Thank you. I don't take the same way home twice because it's traffic in New York and there's always another way to get home. So, so I look for
what started me to doing that, because when I lived in New York, you never go the same way.
That's right. That's right. So it's diversity in all forms. Dr. McCamey, same question for you.
Yeah, so I'm in agreement with the panelists, but also looking at diversity and making sure we're being deliberate and intentional about seeing who's in the room, who's not in the room, who's at the table, and those that are at the table, do they have a voice? Who's speaking? Who's making the menu? Who's setting the table? What messaging is going on there? Acknowledging that we're all different, and the value that brings, that we can, like Dr. McDaniel said, bring creativity, innovation to our clinical practice, to academia, to the C-suite, to DNPs of color conferences, diversity, looking at it. And I like the diversity of thought. I know DNPs of color, when we think about our meetings and our topics, we always think about diversity in geography. Don't forget the West Coast folks, because they have a different vibe. Don't forget the Midwest thought folks, because they have a different vibe. I mean, even down to the very, fabric of, like I said, geography. And does diversity impact change? Absolutely. When we have multiple thoughts and people from places, things, or whatever, I think that it brings a richness to the experiences. It brings a richness to how we take care of each other, how we see each other. And I think it brings more of a understanding of humanity as a whole, how vast and rich and diverse we are as human beings. And I think that the impact of that really enhances our experiences to build a better, larger, more inclusive vision to move forward in health equity.
Thank you. And don't go too far, Dr. McCamey. You're going to answer this one first. In the times we're in now, do you see a positive or negative change in promoting diversity? And how does change impact healthcare delivery?
You know, I can see it from both ways. I think it's positive in the times that we are in now because it seemed like the murder of George Floyd just really just ripped the veil across a lot of people's different eyes. People are seeing things that a lot of us as Black folk and people of color have seen for our entire lives, to the point that it's in our DNA, the traumatic experiences from slavery, oppression, racism. So it's positive in that it's given more light, and it's giving us, I know for myself as a Black woman, more comfort to be able to say that was racist. Like, for example, I was taking a friend to a primary care provider. He has long COVID, and we go in there, and the physician goes in, and he's just like, okay, well, this is my assessment and plan. And I'm like, sir, you haven't even got an adequate history from us. You haven't even like examined him. Like, that's where we get all of our data. And he's like, but this is my assessment, it's my plan. So I'm going to refer you guys out. And I was just like, wait, let's take the time to hear our story. And he was super dismissive, despite, me saying, throwing in the medical jargon and all that. So I took it to Twitter, and it actually blew up. And we actually got some feedback from the institution, because I felt like it was straight up racist. I was like, you cornered us because we were in urban casual wear. We were Black people coming in with COVID, and my friend was unvaccinated. So it just put us in a whole category of, and he was so target fixed on getting us out, and y'all are unvaccinated, that type of thing. So, but getting back to the question. So I think that it's given us a better understanding to have these conversations, and more comfortable to have these conversations. And then sometimes I think that it's negative, because I feel like some of the efforts are just superficial, and that, it's like check boxes for a lot of these companies, and that they're like, oh, okay, well, we've fulfilled our quota with diversifying the C-suite, or we've put together a diversity, equity, inclusion task force, and they run all the words together, diversity, equity, inclusion, as one sentence, versus looking at it from each category of the word. Mm-hmm. So for me, I feel like it's kind of some degree watered down the urgency to commit action to being intentional about diversifying leaders, teachers, preachers, providers. So I'm torn about it, but I think it's good to kind of have that chaotic spectrum, in hopes that we can come towards some pathway in the middle to make some headway to make actions for change. And in regards to healthcare delivery, when we all know the literature supports diversifying healthcare professions, it automatically increases patient outcomes. And we understand that patients of color, they feel more comfortable with providers of color. That's just the way it is. So I'll pass the mic.
All right, we'll go to Dr. McDaniel.
Well, despite adverse conditions and subjection wounds from discrimination and systemic racism, diversity of any group or organization should be a strength and not a weakness. But promoting diversity should never be negative. But unfortunately, just as Dr. McCamey said, since George Floyd was murdered, and I'm always intentionally saying murdered, everyone either started creating or enhancing their diversity statements. But few organizations took the next step, which is to change policies. Because if you don't change policies, you can't hold people accountable. for any infraction. So, and the other thing is that we're talking about diversity, and I know we're being intentional talking about diversity, but of course we all know that diversity alone does not move the needle. That is equity, meeting people where their needs are, and also including people. So I think about like when women are hired into male dominant positions, it's a thought that that's positive promotion, but yet women get paid less, they're treated differently, and they're even frowned upon when they get pregnant a lot of times. So, I just look, and on the other hand, men in nursing, they're often looked upon as that person who's going to move the heavy patient. So so I just think that we just need to have a better understanding of what it means, what it entails, and just embrace people and think about how, I always say, think about what, the golden rule is, think about, to do unto others as they would do unto you. But no, I say, do unto people as you would do, as you want them to do unto you. So.
Absolutely. Thank you. I can tell you as a former med-surg orthopedic nurse, I was often called in to help move patients. And I said, I need help too.
Right. And we have the same credentials, but because you're a man.
Right. Yeah, it's, I think it just goes to show you how much work we need to do with everything. Like, and it's hard work. It's not easy work. If it was easy, we'd all have it done, but we all need to be dedicated and allies and advocates and activists to push it forward. So let's see, Dr. Bryant.
Yes, I have mixed feelings too, like Dr. McCamey. I am optimistic and I'm happy that we are moving forward. And I feel like we are moving forward when it comes to addressing racism in the healthcare system. However, why did it take the death of an innocent man for people to wake up when this has existed for so long? Racism just didn't happen when George Floyd was murdered. So that's why I have mixed feelings. And the other thing, I know, it was like all of a sudden, we have racism. It exists. It's always been there.
Right.
So that's why, I don't mean to be facetious about it, but so I'm glad, I'm, like I said, sad that he had to die for us, society to wake up. But I am seeing changes, but I guess for me, is it enough? Are we measuring these changes? How many more students of color are being admitted to our nursing programs? How many more people of color are on the C-suite level at these hospitals or in politics that are at the level so they can make changes in the policies? So I think we have a ways to go. We're not there yet. And we need to start. I want to see the return on investment or, the outcomes,
right,
of all of these changes. That's what I'm waiting for. And I also am worried that it's like the news, there's a news story, it's a fad, it dies down in 2 weeks. I don't want this to be something that disappears. And I can already see in the news, you hear less and less about racism. And so I think we need to keep this going. We need to keep it alive. We need to keep the conversations going, and let's not back down. This is still a battle that we need to fight, and until we have equal justice for all in all aspects, not even just healthcare. So I'm optimistic, but we still have a ways to go.
Absolutely. And Dr. Buscemi.
So, I have to echo a lot of what my colleagues in the panel here said, and Dr. McCamey said it correctly, that there's still a lot of work to do. And I have to be honest with you, I'm a little disheartened with what's happening here in Miami. Miami's unique in that as a Cuban American, I grew up in a social enclave. So I never experienced what other Hispanics have experienced in other parts of the country, because we live in a protected social enclave here where the majority are Cuban Americans and Latinos, but of the Latinos, the Cuban Americans. So we went to Cuban American schools, we went to Cuban American hospitals, Cuban American pharmacies, restaurants. So you live in that little bubble. And it wasn't until a time that I was at a conference in LA, and it broke out for lunch, and the buffet was managed by what we would call, brown people, phenotypically looking Hispanics. And I'm fluent in Spanish. My mother was Cuban. I grew up with both languages. She served me, and I asked her to serve me a little bit more. And the gentleman who was next to me, who was at my table during their conference, was behind me. He goes, "Wow." He goes, "You're so tall and white for being Mexican." So I did some fast track education. I won't repeat some of the words I said to him at the table, but it's like, though I had never faced that in my life. I had faced some stigma about being gay, especially when I came out in the 80s. I came out in 85. I was 17 in high school, and AIDS was in its heyday. So a lot of times, if you came out gay, people shunned you because they immediately assumed that you had HIV or AIDS. Or if you weren't invited to a family event because they didn't want you near your children because they thought you would spread AIDS, even if you had never had that encounter.
Right.
And I became a nurse in 89. So I went and I worked in HIV AIDS in 1989 because I knew a lot of nurses didn't want to work back then in HIV AIDS. And the importance of having yourself represented in the people you care for, I thought was important. So I could make those special connections with my gay patients, being a young gay nurse. But recently, and I'll be very transparent with you, we recently had an anonymous poll in my college, and only 56% felt that we needed a DEI committee. And I was shocked, I was furious, and we were on a big Zoom like this, and I let everyone have it. Many of you don't know me here, but I have a sharp and cutting tongue, and they all felt it that day. And I said, how could this be? We have a Black dean, Aura Strickland, I'm sure you know the name, who is a pioneer and a mover and shaker in the nursing community. We have a Black Latina associate dean. And yet 56% of the people felt that we needed to develop a DEI committee. Of course, this prompted me to make sure that I was part of the founders for the DEI committee. Me and a Black faculty are going to lead the initiative, because I've been approached to lead DEI things many times because of how passionate I am about it, but I always understand visuals. And the face of a white man should not be the face of a DEI initiative. Because even though I bring in the Cuban American gay perspective, I have privilege that many people on this panel will never experience, because I could be standing on a corner and I am a white man and nothing will happen to me. And that's just the reality of it. So I make sure that any DEI initiative that I'm involved in, I make sure that those who need to be represented are represented, because I think that that's my role as well. As far as healthcare, I have the opportunity, because I do house calls. I see the impact of being a Latino because I do house calls in the Little Havana area. And if you're not familiar with Miami, it's an area near downtown Miami. It's Little Havana because that's where most of the Cubans came in the 60s and 70s, but now it's completely Latino from different areas of the world, not just Cubans. And when I speak Spanish to my patients, you can see the connection. So I think it's important that people receive the care from people who sound like them, or maybe have the lived experience of what it is to be part of that group.
Thank you. All right, so my next set of questions are going to be about transforming nursing practice, and that's sort of what is the common theme here today. Doctoral nurses, DNPs of color in particular. So I'm going to put this out there, and then whoever wants to tackle it first, you could all work on that. So, what is the role of the DNP prepared nurse in transforming nursing practice? Now, don't make me look bad and have to call on somebody.
There's so many things to say to that one.
Yes,
Got
facts.
a minute to get my thoughts
Want to
together.
go for, yeah. Go ahead. I'll wait.
Oh, no, I was getting my thoughts together. You can go ahead. Go for it.
Dr. McCamey wanted to go ahead. So, first of all, we are uniquely positioned to improve this current fragmented healthcare system because it has been fragmented for years and it's going to remain fragmented until we can get ourselves together and start putting in policies for DEI and keep this momentum going. Someone else said that, I don't remember who said that, but it's a terminal degree for nursing, first of all, for those of you who don't know, and I'm sure that the majority of you do because we are DNP strong here today. But we can transform nursing practice because we can go from the bedside to the boardroom. We are proficient in leadership, clinical practice, advocacy in health and policy and academia. And we are excellent at implementing new research. So what I always tell people is pair yourself with a good researcher, a person with a PhD, because as you know that a lot of times the research that they do, by the time you finish doing the research, it's years before it's implemented. And then things have changed because that's the only constant in healthcare is that it changes so quickly. So I feel that we're positioned. I'm at Capitol Hill. I go to Capitol, well, before the insurrection. I was at Capitol Hill a lot.
I know that's right.
I don't know if I'm going to ever feel comfortable in there again, but I'm there, promoting anything that has to do with nursing, how nurses get paid, because I am so sick and tired of nurse practitioners being paid less than other healthcare providers. And so, DNPs have credibility, because of our doctorate, we have credibility, and we're able to go to some places that others can't go. A good example, I left, and I hate to get political because, some people just don't appreciate it, but I left a rally where President Obama is today, to get back here, I'm just throwing that out there, front row in the front of the stage, all because I am a DNP, because they were looking for someone with a doctorate to help them, and I won't get into all of that, but they were looking for someone with a doctorate. And so they called on me to take care of some things, and the reward was for me to have front row to the president today when he's in my state. But that's what I mean when I say credibility. Use what you've learned, and go out there and change the world, because that's what we are here for. We're definitely change agents. And so I'm just calling on everybody. Don't ever think that you can't do it, because here I am, someone who is I'm really an introverted extrovert, or am I extroverted introvert? I don't like being in front of the camera, and here I am, but I have to use my voice, and no one is going to take that away from me. So there's a shortage of faculty of color, and so DNPs are filling that role as well. So go out there and do what you have to do.
Yes, Dr. Pierce-McDaniel, you better preach the DNP gospel out here in these streets. So I can't echo enough all the things that you said, because I feel like the DNP, we are nursing secret weapon. Just to highlight some of the things that you said, I mean, we are strategically placed in a position where a lot of us are still engaging in clinical practice. And because of our DNP education, it's given us the knowledge and understanding of systems, policies, procedures, culture. And when I think about culture, I think about Dr. Karen Keston's class about culture and organizational theory. And we read Edgar Schein's book, but that's another conversation. But having that unique duality about us in the nursing profession, I really like my heart just beats hard, and I just get so excited. I'm like, man, like DNP, like you need to recognize. I always bring out this statistic, and Dr. Ferrara is going to laugh, but there's some data from Campaign for Action. They, over the past 10 years, collected some data. They do a lot of breakdowns of ethnicity by race and education. But there's one statistic that I always drive home because I'm like, we can't ignore this in nursing. But over the past decade, they have documented that over 40,000 DNPs have graduated to 7,000 PhDs. So what for me, that means it's time to start reimagining, putting DNPs in different places and spaces, because there's 40,000 plus of us out here, okay? And so really leveraging us being the secret weapon, us having that unique duality of understanding policies, procedures, cultures, and also how things go upstream, downstream, and patient outcomes. Like now is our time to, like Dr. Pierce-McDaniel said, it's time to shine, take hold of this opportunity in being deemed prepared, and those that are aspiring and currently in your programs, take pride in knowing that we have an opportunity to really move the needle toward our focus on health equity, and that we can be uniquely put in different places and spaces. I mean, I just think that, being a DNP is just the best thing since sliced bread. So that's my little 2 cents. I'll pass the mic.
I mean, I'm going to be short and simple. There is nothing we can't do.
Hey.
We can be in every realm. I mean, listening to what you just said, we can be at the political level, fighting for policy change. We can be in the hospital clinical setting, making, things happen in the hospital and changing protocols and procedures and making sure we focus on health equity. We didn't mention, we're in the academic setting, we're everywhere. We're the ones that are educating those future healthcare providers. And even though we're not PhD, some of us are doing research also.
Facts.
So I just feel like there's,
Yes.
The sky's the limit for us. There's nothing that we really cannot do.
Well, again, I'm PhD prepared. I am not DNP prepared. When I went for my doctorate, the DNP didn't exist almost 20 years ago. So, however, I was one of the founding faculty at FIU for the DNP program. And I've always been a huge proponent of the DNP, and that's why I moved into the role as director of the DNP program. It was sort of questioned, why would a non-DNP be the director of the DNP program? But I think because of my full understanding of the role of it and the importance that DNPs make in shaping healthcare for all. One thing I don't understand is when we're talking about equity is, why can an MD be a PI on an NIH grant, but a DNP can't? You have to have a PhD. That doesn't make sense to me. A DNP, and you're right, Dr. Bryant, DNPs are educated and trained to do research. This notion that it's only for PhD prepared nurses needs to be, again, this whole thing of disrupting and dismantling the norm. We need to move away from that. Some of the most impressive scholarly work that I have seen are from my DNP students, and I am inspired by them on a daily basis. And I want them to take that work and do the change, not just bind it and it gets tucked away in somewhere on a shelf in our college. Take that project you did that's so powerful and change healthcare, change policy. And if it has a DEI focus, even better, because you can uplift people's lives. But I think that as the DNP becomes the norm and will eventually become the terminal degree, I think that we'll finally reap more benefits from what's happening with the degree. And you have a huge champion and a huge cheerleader for you from the PhD side, in me to my DNP colleagues, for sure.
Absolutely. And, I'm not supposed to talk a lot as moderator.
I was going to ask you to weigh in on this question, sir.
But I'm
Definitely.
like, I can't help myself. You know, these issues that we're talking about, they're not separate. And they are all related. And I truly believe that when we talk about health policy, which is my area that I am most passionate about, it's really important for nurses, doctorally prepared nurses, all 4 million of us across the United States, to speak with our voice and speak with our vote. 2 weeks is election day. You know, it's not a presidential election, but there are school board folks running. There are all types of mayors and governors and all, you know, offices up. I would love to see more nurses running for office at the highest levels, or even at all levels, really, because nurses need to be there. So, you know, speak with your vote. Your vote is what is so important. But, you know, I'm not naive enough to think that by voting, all these issues are going to go away. We need to all be involved with it. And look, not everybody wants to run for office, and that's totally fine. But you need to be aware of what the issues are, who's running, where they stand on these issues, because we have the power to put them in or take them out the right way.
Yes.
If I could just jump in
Yes,
again,
yes.
Dr. Ferrara, and you bring an excellent point up, and we have local here, you know, Elsie Hayton's seat is open for the last year, and we have a former colleague of mine from Jackson Hospital in Miami. She's a DNP. She's a former Broward County commissioner, former Broward County mayor. She's a Black woman, Dr. Barbara Sharif, DNP. Google her, donate to her, because she is running for Congress. And I think it's so inspirational that if she can win, you know, as a DNP, get into Congress.
Awesome. Thank
I
you.
wanted to jump in as well. I wanted to jump, sorry, because a lot of people don't think that they can do it. They don't think that they have what it takes. If you are a DNP, okay, if you have obtained a DNP, you have what it takes. Don't think that because you don't like talking in public, you don't speaking, you will do it. You can do it. So anyone, I just know a lot of people who say, I would love to do it, but I don't think that I can do it. You can do it. Just try.
Absolutely. Well, I'm ready to do something. I hope everybody is as pumped up. My next question is this. So, you know, we talked about voting. We talked about getting involved, looking at policies. What else can we do? What can anybody give us some actionable steps that maybe we can implement on Monday morning, or Sunday morning, when, you know, healthcare is 24/7. So what can we do? Some actionable steps that we can take to start to implement some of these changes. I'll give everybody a second to think about that.
Well, I'm just going to bring up one small thing that we all could do right now to promote a more inclusive and safe space, and no one's obligated to do it. But I think something as simple as including your pronouns on your Zoom name provides an opportunity that you are promoting equity and inclusion. And believe it or not, it's something I do at all my faculty meetings, and usually when I get myself and somebody else. But again, no one's obligated to do it, but something simple as that creates a safe space for people like me.
Thank you. Easy to do.
I always forget to do it.
That's a good
I don't know
actionable
why it
step.
doesn't stay.
And I
Go
want to add on to what Dr. Buscemi, I'm sorry if I didn't pronounce it correctly. What I also did too is I went on Amazon and I got a simple rainbow heart sticker, and I put it by my office. So again, people know this is a safe space to talk about any kind of issues and making it more welcoming, particularly to our LGBTQ community. The other little tangible things, and I need to work on this. We need to just speak up. We need to not sit there and be in these meetings where things are being said that are offensive, where policies or procedures are being implemented that we know are racist. We need to be a voice and actually have the courage to speak up. I think that's one thing we can definitely do. And then being part of the solution. We need to sit on these committees. We need to have representation on all those major committees, whether you're in a hospital setting or the academic setting. Sit on those DEI subcommittees or committees that they have, so that you have a voice at that table. I would
I
say
think,
those are.
sorry. I think one thing I want to add to the conversation as to what we can do starting tonight or tomorrow is self-reflecting, seeing where we are with our own biases, our own perspectives, our own lived experience, and how it shows up in the way we live, move, work, and manage and care for patients, students, colleagues. So really doing the work within ourselves. I mean, just because I identify as a Black woman or person of color doesn't make me exempt from being biased because of whatever. Bias extends across the spectrum of all things. So looking for opportunity to make yourself better. So like, for example, we're all on a Saturday, in a conference all day, and engaging in conversations on how we can be better individuals, better human beings, better providers, better teachers, better mentors. So I think truly taking time out to self-reflect and really don't shrink yourself or play small. Really come with your authentic self. And that's something that I've been learning and evolving as I've grown into myself as a DNP prepared advanced practice registered nurse, as a CEO, as a chief of a department, as a Black woman, as an auntie, as a daughter, really being in a place and space where I show up who I am, braids, fro, with my little, lingo, because there's nothing more validating when you not only be there to make space, but you create space by being your authentic self. So my contribution to what we all can work on is just self-reflecting and showing up as your authentic self.
I really believe that you were looking at my notes because I was about to say that we first need to examine our own biases and examine how racism lives in each of us as individuals, and in the fabric of our organizations, our policies, culture, in traditions, some traditions steeped in it. And just like Dr. Beard said, those textbooks, for crying out loud, I mean, that's long term. I'm sorry. Hold yourself accountable to equitable excellence, because that's what we're in everything, and all out, outcomes in your academic setting, in your healthcare setting, and just educate yourselves, because the thing that troubles me greatly is that a lot of people say that they are very diverse, and they say that they understand diversity, equity, and inclusion. But if I ask them, and let me give you a good example, Dr. How do you say your name? But say it, please.
Buscemi.
Buscemi.
That's good.
Buscemi. I know it's not good. That's another thing. Be intentional when you are calling someone's name. So I'll just say Dr. Charles. So I was in at another conference, and I was talking to someone about what am I say? I lost my train of thought. I was talking to someone about the Two-Spirit. And I wanted them to, I was trying to make them understand what Two-Spirit is, because I had been doing some simulations for some DEI work, simulations for Canada. And so they are very, it's prominent in Canada, and I don't hear us talk about it enough in the US, but Two-Spirit, these are the natives in Canada, and they feel as though they have two spirits. One may be female, one may be male, and it's fluent. You know, they're very fluent. So we just need to, the reason why I brought it up is that a lot of us don't know about it, and I want people to know about it, so I threw it out there. And we just need to learn as much as we can about DEI, because it's not just about racism in America. You know, we have all other things that are involved in it as well. And I want to say to you, I appreciate what you said, you know, about your privilege, but I also want people to know that Harriet Tubman did not get through the Underground Railroad without having some white people that were helping along the way. So I just wanted to say that.
Okay, that's well said.
Stephen, I just want to add one last thing is
Sure.
things that we can do immediately. And I think it's very important is that, you know, whenever you come across it, and I agree with the panel, call out racism and bigotry right in the moment, and call out performative bullshit. You know, I'm so tired of seeing it over and over, where people say they're your ally. They say it and doing the right thing. When it comes down to the nitty gritty, it's all just performative. And don't be afraid to call that out as well. That's all.
Be intentional.
Absolutely. So at this point, I'm going to open it up to Q&A. And as you have some moments to type in your question, we are running short on time. And if you'd like to go through the break, we can, but I want to be respectful of everybody's time. So we'll see how that all shakes out. But I am going to ask one question as folks are trying to type up questions. And I'm going to ask you to limit your response to 30 seconds. And I know that's a really short time, but think about, are there current strategies or initiatives that address health disparities and health equities in our patients, right? Because again, we're clinicians, right? We may not be actively seeing patients, but that is also the unique thread that binds us. So are there any initiatives that are addressing health disparities and health equities for our patients that you could share at this moment in time? And I'm going to look at some questions while 30 seconds. Now nobody's going to go. Kellie, I see you. So
Yeah, Kelly's saying something.
Oh, no, I wasn't.
But you are now.
I was thinking if anybody in the audience had some initiatives or something that they
Well,
wanted.
Kellie, I mean, I don't want to speak for you, but you are working with the New York City Department of Health on certain issues. You want to share a little bit about what you do there?
I love how you just called me out. Yes, that's a good example, because I sure did. I wasn't thinking of that. So yes, we have a significant problem with opioid use, and particularly with people who inject drugs in South Bronx area. And they called us in desperation because as they were doing outreach in the streets, they were finding, these individuals had substantial wounds to the point that they were getting sepsis, getting their limbs amputated. And the reason they didn't seek care is because the hospital that they're around provides horrible care to them, bias, care, and I don't have to tell you, don't get treated fairly. So therefore they don't want to go to the hospital. So they reached out to us to see, can the nurses come out and do some outreach right on the street and help these individuals? So I just, I had to do something. So put in for 2 grants. We were successful at getting 2 grants. I was going to work on an initiative of using some of our nursing students to actually go out with the outreach workers to try to assess these wounds, use motivational interviewing to try to motivate them to seek care for the wounds, because obviously if they're infected, we can't really do much on the street. We're not here to give antibiotics, and a lot of these individuals require hospitalization. We have a wonderful wound care specialist who's actually here today, Tawana Dennis, who's here in the audience. She's participating on our project with us. Thank you very much. And so that's just one way of, again, there she is raising her hand, of us doing something. It's not going to solve the problem, but at least we're having, us impact and helping with these disparities.
Okay, question in the chat, and I think this is going to be for Dr. Buscemi. Can you clarify, do you call it performative bullshit or ornamentation tokenism? Or are each of these the same thing?
I think there's some overlap. I do agree that there is some ornamentation and tokenism in many of these people who are performative, but I'm really referring to these people who want to increase their social capital, you know, rather than a direct impact to the cause. We've seen it, you know, we've seen the typical person who will go and take a selfie in front of a symbol that's supposed to be something to promote diversity, and then it's just to get Instagram likes, you know, or someone will think they're saying the right thing at a meeting, and we know that they have no idea what they're talking about. Like we all discuss, we know those people, we can feel it when it's not right. It's also called surface level activism. You know, it's just, I think now it's time that we need to get it deeper. And another thing is, you know, we can do is, and I'm sure my Black brothers and sisters on this panel can agree with this statement, is that I am to the point where I'm done educating you on LGBTQ issues. It's 2021. Google is your friend. If I can help in a certain way, but don't come to me and say, when I tell you I'm married, and say, who's the husband and who's the wife? You know, educate yourself. If you don't know what the Q means, educate yourself. If you don't know what the I and the A means, it's time, because it just gets to the point where it just gets exhausting. That's all.
I know a poll, thank you, Dr. Buscemi. I know a poll went out to see if folks wanted to extend the session. I know we're up against the time. Dr. McCamey, did you want to share the results of that poll? Looks like people want to keep going. Well, if you'd like to take a break, feel free to step away. I mean, this is, you know, I am honored to be the moderator of this discussion, and I think we could probably talk the rest of the day. But I know that there are other sessions. But since the majority of folks do want to continue speaking through the break, I have another question in the chat. Let's see. Currently working on an initiative to increase the number of non-whites at the supervisor and above level. Any tips you can share that would be helpful? And I'll leave that open to anyone who wants to
One thing came to mind for me, and I don't know if it directly answers the question, but something we haven't talked about that's important: mentorship. Those of us that are at that leadership level, are we helping others to get to that level? Are we pulling someone else up with us, and we're showing them the ropes and making sure they, you know, they have that person that they can come to for mentorship? I think that's what's missing a lot of times. Do we see that student that's been a great student, that's interested in education, and giving them that first job, maybe as an adjunct? The next thing you know, here they are with a full-time, you know, teaching position. That's how I started. So I just want to stress, whether it's in the academic or the hospital setting, please, let's look out for each other and, you know, and mentor one another.
And I think also it's especially in academia, we need to move away from this notion that tenure is only for PhD prepared people. I think if the DNPs are putting in the work, and they should be hired on a tenure earning track, and they should be able to earn tenure.
I totally agree with both of you.
Absolutely. I have another question that I'd like to ask, and you know, nursing organizations have not historically been the most welcoming organizations, and that's a sad state of affairs. So in what ways can nursing organizations like DNPs of color create substantial change to reduce health disparities and advance health equity? So in what ways can nursing organizations do this work?
I guess I'll start. I'm a member of the Greater New York City Black Nurses Association. And one way we use our numbers for power. We actually are having conversations with our politicians. We go to some of their meetings. We speak, you know, at for example, the New York Black and Puerto Rican Caucus. We're getting our voice out there. We have town halls and workshops, particularly after the George Floyd incident, where we had Chuck Schumer at our town hall. So I think that's one way, is to, as an organization, use that strength to, again, let's affect those policies. Let's talk to those politicians in order to make some huge changes.
And let me remind us that, can you see this?
Hey,
Okay, you know my girl goes with me everywhere.
I know that's right.
Okay?
What's up,
So
Mary?
So I just want to remind people that, many people think that there's no need for organizations such as Docs of Color, National Black Nurses Association, but I just need to remind you again, okay, that, Mary Eliza Mahoney was not welcomed. And when she was the first person to join what is now the American Nurses Association, and so super excited that they're doing something about that. They're putting out a statement on racism, and it's more than just a statement, and I'm excited about that. But I'm just saying that to say that join your organizations. Almost all of the organizations have a advocacy tab. And go to Capitol Hill, go to your General Assembly and all of these places, and get to know the legislators that are making the laws, because we have a lot to say and we have a lot to offer them. And so I just wanted to just throw that out there. That might be a little bit off from what the question was, but just to let you know that there is a need for these organizations, and that those organizations are doing things to impact social justice and social change.
I would say, speaking specifically to DMPs of color, I mean, I created it out of my experience of not having a space within my academic institution that supported me being a woman of color pursuing my DMP. So I think us as an organization, having the space alone has been, from a lot of people, what they've been telling me just in conversations and watching the conversations in our private Facebook groups and also having one-on-one, is that just the very fact of this space being in existence is motivating and inspiring alone. That they can sit and see other folks that have had the similar lived experience and become encouraged to continue, or be encouraged to represent, to be encouraged to speak up, speak out, lean in, push back. So that's kind of with DMPs of color, really living our mission to inspire, empower, and transform the landscape of nursing to increase diversity in doctoral practice, leadership, and beyond. So I think being a part of movements like this, and like Dr. Bryant mentioned, National Black Nurses Association, that's a powerhouse organization and has done tremendous work in mentoring, uplifting Black nurses specifically. So I like that we're building this space, and I like, as we're continuing to grow and strengthen our foundation, we'll be, offering education, sponsorships, mentorships, so that we can get that supplement of support to be able to, once we get a seat at the table, to be able to effectively speak. We know what we're talking about, we're quoting literature, so that we can navigate and not be intimidated. Because what happens is we get the paper, and like Dr. McDaniel say, Pierce-McDaniel, we don't speak up, or we don't feel like we're capable or worthy. So my hope is that we instill those qualities of being capable, worthy, and being excellent. And once we get a seat at the table, docs at the table, we'll be promoting diversity and transforming nursing practice.
Absolutely.
And I think we need to be brave enough to have a conversation of who Florence Nightingale really was.
Hey.
And realize,
Yeah.
and realize that we need to stop deifying her and her contributions to nursing. And we need to know the contributions of others, people of color, Black nurses, people of color, who have truly impacted nursing, and realize her racist background, her colonialist background, and start dismantling this Nightingale pledge, which I don't do it when the graduation or the ceremonies happen. I don't do it. And we're working towards that, and I will make sure that somehow my institution it's dismantled completely, because I think that it's the wrong way to go.
Mhm.
And there's so many other Black nurses, worldwide. Another great one is this one. I hope you can see it. And, we don't talk about them. No one told us that these Black nurses were working in the Civil War, so.
Yeah. Where was that in our introduction to nursing class or introduction to nursing profession? That's what we need to have taught in those classes.
And men in
Absolutely.
nursing.
Exactly. At the very beginning, the men were the ones that were the nurses, and people don't know that.
That's right. Dr. McDaniel, can you hold that book up again? Somebody.
Which one?
The
This one?
last one, I believe. The path we tread.
Oh, wait, I have to get precision. Can they see it?
Yes, they can see it now.
Okay.
Good. Thank you. Well, this has been an amazing discussion. And I think we should leave it there, because at 2:55, you need to be back in the virtual auditorium there to start the next session. This will give everyone some time for a quick bio break. But I'd like to thank all of the panelists who gave such rich, insightful, impactful answers. And I hope you are all inspired like I am right now. And there is really nothing else that could stop us. And I truly, truly believe that. So with that, enjoy the rest of the conference. And again, my pleasure moderating this panel. Thank you again.
Thank you so much.
Pleasure being here.